Hey everyone, what's up? This is Dr. Charlie, PT. In this video, I want to share with you two simple ways that you can strengthen your lower back as safely and effectively as possible if you currently have back pain and or you've had back pain in the past. So a lot of people ask me, Dr. Charlie, what's a way I can strengthen my back to either prevent back pain and or reduce it? So we're actually going to head to the gym. I'm going to walk you through two simple ways as well as some modifications that you can start to get your back stronger. Car door is locked, so we're not headed to the gym yet. All right, so we are officially unlocked and inside the vehicle. So real quick, for those of you who don't know me, my name is Dr. Charlie Johnson. I am a physical therapist. I specialize in helping people worldwide with unresolved back, butt, and sciatic problems. Basically, I teach people how to fix themselves using the power of their mind and movement as medicine. All right, so I'm sitting here. I was in the car, but I'm back home because I just thought the gym is going to be super loud. We're actually going to use this gym. I'll show you using sort of a model, if you will. Yes, I know. No hair, don't care. We're going to show you a couple simple strengthening exercises to help you, again, increase the strength in your lower back. So let me set up, and we will show you them here in a second. You good? All right, say hello.
Hi.
That's my wife, Heather.
Can you tell me beforehand what you actually want me to be, how you want me to be standing or doing?
That's what I want you to be doing. Just holding yourself there. Can you hold yourself?
Well, yeah, I'm just saying. Okay.
Okay. All right. All right, so the first exercise you're going to do is kind of what we call like an extension hold. And this is an isometric exercise, meaning you're not moving in all kinds of different ways. You're just getting yourself in a position and then you're holding it there. And so one important thing to understand about the deep muscles in the low back are that they're more of a type 1 slow twitch, meaning they're more endurance-based muscles. So you want to train them specifically by training their endurance. So you ever go to the gym and you see someone on one of those back machines and there's a pad at their hips and they're doing this, they're holding weight and they're doing this, they're extending repeatedly with their lower back. Well, there's probably a better way to do it. And so I'm going to show you now. All right, so what you need is you need a ball, okay, and probably take your shoes off, so you need a wall. Hopefully you have one of those around, and maybe a pillow or a pad for the knees, all right? And so what you're going to do is in that position, you're going to kind of pull the ball in, push down a little bit, and just get your hips right over top of it like this. Perfect. And now remove your hands and fold them over your chest, okay? And now what you want to do is you want to create like an imaginary line between the shoulder, the hip, and the knee. And so you can see she's a little bit kinked right now, probably because she doesn't want to hold it any longer. She has to hold it, all right? But what I want you to do now is picture you're extending from here and just raise it up. Perfect. And so that's pretty darn good, right? So what she's going to do is she's going to hold this position. And because these are endurance-based muscles, we want to hold it for time and not do a ton of reps. So again, what I was referring to earlier is you see people hold the weights and they do all kinds of different stuff, but then they're hyperextending and then they're flexing, and it just introduces a lot of different variables. So just get it in a position like this and hold it. And ideally, you hold it until you're fatigued. You need to make these things challenging. So a lot of times what you see when you do bird dog, you all right?
Yeah.
When you do bird dog, for example, it's just not sufficient to change the strength of the lower back muscles. But if you isolate and you make this muscle really fatigued, you can improve it over time. So where did you feel that working?
My back.
Good. Anywhere else?
My hamstrings.
All right, got it. Okay, so get in that position again, right? And right in line, perfect, just like an inch up. Boom, right there, okay. And you would hold that again 3 times until fatigue. So aim for maybe 45 to 60 seconds, break, shake it out, walk around, do it again, break, do it again, 3 45 to 60 second holds or holds until you're tired. Now keep in mind, this cannot be painful and or yucky. If it is, don't do it. Or maybe you're hyperextending too much. Can you show them what hyperextension too much looks like if you got the juice? Yep. So you can see now she's kind of like really arched, right? And so probably don't recommend going that far. Just hold it neutral, but hold it until you're tired. Is that tiring?
Yes.
All right, let's start over. Let's do that again. And real quick, if you have back pain or maybe you've had it in the past and you're curious about what could be causing it, I've laid out my entire diagnostic algorithm. You can actually download a free DIY diagnostic guide that walks you step by step through how you can figure out the most likely source of your symptoms. All right, so let's just say that the ball doesn't work because either you don't have it or you just can't figure it out, or your feet are slipping off the wall or something like that. Here's something else you can do. Now, ideally, you might have another pillow, but aside from taking like my bed pillow and putting it on the floor, which I don't want to do, we'll just take some of these. All right, so what you can do is you can just lie flat. You can lie flat on your bed or on your floor, but get a couple pillows here and put it not directly under your pelvis, all right? So not, say, all the way down here, but put it up just higher, all right? So it's centered somewhere here along like the belt line, all right? And now what I want you to do is go ahead and just lift your chest about like an inch or two off of the floor. Perfect, hold it there. Now notice she's not hyperextended. Go hyperextend. Ugh, she's having trouble even doing it, it's just hard. You might need this. This is good. Anyway, be sure to select a model that can perform the exercises. So go ahead and hold it. Half an inch. It makes it harder if your arms are up here. So if you want to put them across your chest or something like that, or by your side or whatever, yeah, perfect. That's another way to do it. And you can just hold. She's going to feel it here, squeezing her cheeks and her back, probably everywhere, maybe even her neck, right? And you don't have to hyperextend your neck, so you can keep your chin down. I think you get the idea, all right? You can relax. All right, so the idea, right, is that this is a little bit harder, all right? This is a little bit harder because you're completely flat versus if you're on a ball, you're at like a 45-degree angle, all right? So just notice that the more inclined you are, if you will, the easier it's going to be. The more declined you are like this, pretty much flat, the harder it's going to be. But pretty much everybody has a couple pillows. Okay, so something to think about, that is a modification. Again, it should not be painful. You do not have to hyperextend. You just need to lift like 1 inch off the ground and hold it a few times until you're fatigued. All right, so final exercise, a little bit more functional, if you will, but it is, where are we? There we are. It is a form of squat, all right? So what you're gonna do, I'll get this right, there we go, is you're going to hold a weight. Now it doesn't have to be 25. It doesn't have to be a 25-pounder. It could be just a medicine ball or I don't know, a gallon of milk or whatever you have, right? And I recommend like put some type of like chair behind you. But basically you're going to do some type of squats and the weight is in front of the body. Why? If the weight is in front of the body, it makes the back muscles have to work harder to hold you up. If you have a barbell or something behind your back, it still has to work, but this makes it even a little bit more challenging. Now, if you can't do this with any weight, and you're just like, Charlie, gallon of milk is too hard, then you could just simply hold your arms straight out in front of you. Perfect, right? And so you get the idea that if you have more weight in front of you, then it's going to require your back muscles work a little bit harder to hold you up. Hopefully that makes sense. So what you're gonna do is you're simply going to keep it. Notice how our elbows are aligned underneath the weight, so punch them out a little bit further. Perfect, good, great. Okay, so now go ahead and just tap your butt right on that chair for me, if you can.
Keep going.
Yep, keep going. How many? Until you can't anymore. And so I like the chair because sometimes people have trouble doing squats. So for example, if I take chair away, some people will kind of do funky stuff when they squat. Show me a funky squat, do you know what I mean? Or you kind of know how to squat. That's a pretty good squat. Back on up. But show me one where like the knees drive really far in your bodies. Yeah, people do weird stuff and they just don't know what to do. The camera's shaking, sorry. People just don't know what to do if they don't have something behind them, all right? But if you put a toilet behind them, you could do this in your bathroom, but that might be a little weird, and or you put a chair behind you, then it's just a natural target. And we know that people like targets, okay? So when you perform this, again, as you go down and the weight's a little bit in front of you, your back muscles have to work hard to hold it up. But again, you have to make this challenging. If it's so easy and you get no fatigue in your back and or your kind of hip region, then it's just not going to be effective and or enough stimulus to create a positive change. So you can start small. As you get more confident, you can build it up. You really don't need to do fancy exercises. Again, what we know, and I alluded to this earlier, if you do bird dogs and you do these little isolated movements, there's no problem with that, and I'm not saying it hasn't maybe helped you, but they're just not sufficiently challenging to cause any type of change in the strength of your lower back. So you're going to want to make back strengthening super simple. Notice I didn't say easy because those things are hard, but super simple. Perform an isolated motion, maybe like a back extension hold using a ball. You can get creative if you have one of those machines at the gym. Just hold it. You don't need a weight to keep going and do lots of reps. Just hold it for time because these are slow twitch, type 1 endurance-based muscle fibers. You're going to want to challenge the endurance of them, postural control of them, if you will. And or if you just have a couple pillows, maybe load up 3, 4, 5 pillows. Doesn't matter, try it out and just work on lifting your chest just a little bit off the floor and holding it. Remember the floor one, right, where she was like passed out and had a hard time doing it. If your arms are up here, it's gonna be really hard, but you can put them by your side and just do a little bit of a chest lift. And then if you want more function, right, you can go ahead, you can do some type of squat. There you go. She acted like she wasn't like slacking on the job or something like that. She was doing them the whole time. So you could hold something very small in front of you. It could just be your arms straight out in front of you. Then it could be a gallon of milk, whatever, right? You can progress as heavy as you're able to tolerate. And again, you need to make this challenging. If you don't, then it won't change anything. All right, so hopefully that was useful. Again, this is Dr. Charlie PT. I'm now having to use my other hand to hold up this phone because it's just super tiring. So if you have any questions, let me know in the comments below. Hit the bell for notifications after you subscribe so that you get notified when I go live every single week, or at least that's the goal. And then hit a like. That's all I got. Again, this is Dr. Charlie. Thanks so much. Until next time, chat soon.